I look forward to seeing you back at your report of findings, and here's what you can expect at this visit. We'll be going over this report of findings summary form, and we'll be talking about what's our job and what's your job. And our job is to present the information. Your job is to decide what you want to do forward from here. We'll be talking about things that we found going on, that we also discovered, and what that's keeping you from doing in your life. Then we'll be talking about things like what's going on, can we help, how long will it take, and how much it will cost. And then I want to say that all chiropractors deal with interference in the spine, but we are specifically trained to find interference in the brain as well. So we'll be talking about if the left and right brain are off and what that means for you in terms of balance, posture, muscle tone, control of the autonomic nervous system that controls your blood vessels, organs, and glands, your immune system, and peripheral nerves. How all those are affected by left and right brain balance and by something we call central integration, which is the brain's ability to communicate with the core muscles and the muscles in the center related to your bladder, your stomach, and organs like that. Next, we'll talk about specific brain lobes that showed signs of functional stress in our exam. That could be our cerebellum that deals with balance, coordination of movement, muscle tone, posture. But it could be other areas like in our frontal lobes or our temporal lobes that relate to memory and things like that. So we're going to be discussing that. Next, if you had an EEG, we will go over the patterns that we're seeing on the EEG, if those patterns relate to sleeping problems or stress tolerance or anxiety or depression or getting stuck on thoughts or processing speed of the brain or tendencies toward attention issues. We'll be covering all of that and explain that in simple terms for you. Next, we'll talk about your heart rate variability exam, which relates to your autonomic nervous system. It'll tell us if you're too much in fight or flight. It'll tell us if you're not enough in rest, digest, or repair, and all of that balance, which is very valuable information. We'll actually have a heart rate variability age for you compared to your biological age, and we'll see where that's at. Some people it's younger than their biological age, and some people it's much more advanced, meaning that they're in an accelerated aging pattern. Now, we'll be discussing any myotones. Those are brain muscle to muscle connections that were weak. We'll be discussing any cranial nerves, those nerves in your head that control the face and the throat and the neck. We'll be discussing those and what that means for you. And then we'll talk about any factors related to your hormonal system, to your immune system, or to your detox pathways that we picked up either in your history or your exam with the different reflex points and any labs that you may have already brought to us and how those all factor in. Then we'll be making a recommendation if there's any further tests that we need, such as certain blood labs, hormonal testing through the urine or blood, a DNA-based stool test, or a micronutrient test for toxins are the most common ones, and then we have many, many advanced immune tests that we can do as well. Next, we'll be talking about what are your health goals and how committed are you to get there on a scale of 1 to 10. And if you're going to keep your appointments, you're going to make dietary changes that you need, and if you're willing to go through some ups and downs in the healing process, and then we're going to make some recommendations for your care. What I think would be the best care possible. Now, what I think and what you think, we're going to try to match it according to your goals. However, if what I tell you is more than you can do, then you simply tell us, and then we're going to get something that you can do and take one step at a time. But my job is to recommend for you what is going to help you get to optimal health if that's what you want to do. You may just want some relief and you may not be concerned enough with optimal health. But if you are, we're going to talk about what it takes for you personally to get to optimal health and what optimal health would mean like for you, like energy and sleep and focus and concentration and better relationships and all that sort of thing. Then we will be talking about what are the specific things that we recommend that we do for you, which types of adjustments, which types of resetting the brain to trauma or pulsed electromagnetic field therapy, which restores the electrical charge to the cells, or neurofeedback, which trains the brain for greater efficiency and working better. Foot baths, which help us detoxify. Back on track traction, which helps us open up the joints and heal faster with our lower back. And in-office brain exercises, which allow us to strengthen certain areas of the brain so that you can heal better. And then nutritional consultations, where we develop specific game plans for you in terms of diet and nutritional supplementation based on both labs and hands-on testing in the office. So we'll cover what all we recommend for you and how long that'll take and how much that'll cost. And then we'll talk about where we expect you to be after this care plan is over. Do we expect you at 100% health? Do we expect you most of the way there and just a little bit left to focus? Or are we going to take a small piece of the pie, so to speak, in the beginning and then reevaluate quickly so that we can get a better perspective on where we need to go? So we'll talk about all that. We'll talk about any anticipated obstacles, and we'll want you to let us know any concerns that you have in terms of getting here so many days a week or so many times a month, or any of those factors that may hinder you, like you're going to take a vacation for 6 weeks in the middle of our care. We need to figure all that out so that we can work around that and help you have a game plan to reach optimal health. So that's what you can expect on your report of findings visit. So the most important thing to think about really beforehand is, how healthy do you want to be? Do you just want to get out of pain or get over a specific symptom knowing that we haven't corrected the underlying problems? Or do you want to get to optimal health for you? Health as great as possible, where you sleep great, have great energy, have great focus, have great passion, and are really engaged in life, where you can contribute as much to your family and to those around you as possible, and enjoy the heck out of life. So if you want to get to optimal health, be thinking about that and what that means for you, and we'll discuss all that. So I look forward to going over all this information with you. You definitely want your partner there, your spouse, your support person. If it's a child, we want mom and dad there, both if possible, because everybody's going to be involved in this game plan, and anybody that's going to help you with the finances we want there, because that's just a necessary part of the care. So all that information we're going to cover with you at your report of findings. I look forward to seeing you there. And as I mentioned on my previous video, we've been in practice 35 years. I have thousands and thousands of hours of continuing education. We have a United States trademark on our process, and we've seen people from nearly 20 states, 18 states now, that have came exclusively to Paducah to come to our office. So we are not messing around with your health, and we want to find out, how healthy you want to get, and we want to help you get there. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.